Hello, everyone, and welcome to this webinar. It's called Why We Have AI in Our Practice and How It's Helping Our Practices and Patients Grow. I'd like to welcome our three panelists. If I can ask you please to introduce yourselves, starting with Kunal.
Hello, everyone. My name is Dr. Kunal AI. I'm a principal dentist at Meliora Dental based in Leeds. I bought the practice in February 2023. It's a full surgery practice. We are mixed practice with 50% NHS, 50% private. I've been working with, or have actually introduced Pearl to our practice since last year when I bought it. In terms of my work itself, I've done an MSc in dental implantology, PG diploma in clear aligner therapy, and to complement my implant work, I'm doing a diploma in oral surgery at the minute.
Thank you. Amanda?
Hello, everyone. My name is Amanda Bassi Duke. I work for Dental Care Perth. It's the Centre of Excellence for Clyde Munro up in Perth. I have special interest in orthodontics, both fixed and removable, which I have a PG diploma in. I'm currently doing an MSc in restorative and aesthetic dentistry, and I've been using Pearl for about a year now as well.
Thank you.
Well, that's going to be hard to follow. That's going to be hard to follow now. Hi guys, my name is Harpinder Jugan. I'm a principal dentist at Limehouse Dental Practice. We have two sites, one in the Cotswolds, specifically Hook Norton, and another site in Buckingham. And I am trying to specialize more into the implant side. And I've been using Pearl AI just over a year, possibly. And I must say I'm dependent on this on a daily basis. It's very, very helpful.
Well, thank you, all three of you. Thank you for all joining me. I'd like to also thank Pearl for sponsoring this webinar. I am going to quickly do a small demo of the software so everybody has a little bit of an understanding for it. If I could just share my screen. So this is what it looks like. It is on a website, so it's cloud-based. And once you take an X-ray, it will appear into Second Opinion. You will then be able to view your patient's X-rays on the system with the AI detections on the X-ray. This is probably the most amazing toolkit we have, the button that allows patients to engage in conversation, to start to understand their treatment plans, their tooth morphology, and we're going to take it from there. I will now ask our panelists to answer some questions to help us to understand the software a little bit better. So how is it that you use AI in your practice? So again, if I could just go with Kunal, please.
So AI, I use it for notes taking. So I use Kuroku for my notes taking. I use Pearl for my X-ray. The reason why I chose Pearl, or why I use Pearl in my practice, is previously when I was working as an associate at different practices, what I found is that every dentist perceived an X-ray or looked at an X-ray in a different manner. For me, where I would have thought, okay, this needs a filling, another dentist, if the patient went to another dentist in the same practice, their response would be, actually, I don't think it needs a filling. So in my head is that it gives that, it just messes up with the patient's brain. Is that, so do I really need a filling or do I not need a filling? So when I bought the practice, I wanted something there that no matter who the patient is seeing, they always get the same result. So I found Pearl, I went through a few Pearl's comparatives, looked at there. But what I found with Pearl is that I found it more interactive. What I mean by that is having the system in the practice helps each dentist to give you the same treatment plan. And it's not just the treatment plan, it also helps with the engagement. So I can show the image, and like you showed it just now in different images, the patient gets a better idea of where the problem lies, why is the problem lying. So the way I explain it is, if it's on the occlusal surface, that's because you're not brushing. If it's on the side to the interproximal, that's because you're missing areas, not flossing or using interdental brushes. And then showing the percentage, that helps me to, with my treatment plan, with the patient understanding that how deep the problem lies. So I would say if a percentage is showing more than 50%, my explanation, my treatment plan to the patient is they will try with a fling, there's a chance, possibility that it's mainly a root canal, and the patient understands it better. There's much more of a positive rapport that builds up, the trust builds up, and it just seems like everyone in the practice is singing from the same hymn sheet there. So now I can send it to my hygienist, my therapist, or another dentist in the practice, and they will agree with the same plan.
Okay, and just to show everybody what you meant by the percentage, so if I just hover over that detection, it's actually breaking it down for us to let us know how much of that is in
so
enamel.
If I can just jump in there,
dentin.
So the way I would explain that to you is the enamel is 27%, so it shows that the bugs have penetrated or burrowed through the enamel into the dentin. And when it's 73%, that means that it's very close to the nerve. Even though on the X-ray, because an X-ray is a two-dimensional image, where the tooth itself is three-dimensional, it's giving us an idea that it's very close to the pulp, which is that purple zone, which increases the chance that the tooth may need some further invasive treatment.
Mm-hmm. Thank you. Amanda, how are you using Pearl AI in practice?
So I always say that I probably have the most educated patients in all of Scotland. I work in a practice that's quite technologically advanced. We have scanners in almost every room. So I use Pearl on my prime scan that's facing my surgical chair. So every patient gets to see their x-rays. So I would take my x-rays as part of the early bits of my checkup appointment, and I will do my entire examination, and I sit with the patient and we look at the screen together, and I just say, let's have a chat. I absolutely love Pearl because what it shows the patients, and just like Kunal has said, is that it shows them how deep the decay is. It's very difficult when you're looking at a sea of gray. We've had years to look at this. We've had years training on this, but a patient, and most patients have no clue what we're talking about. They can understand depth. This is where the pulp is, this is where the nerve is, which is what I say, and this is where the bacteria is. And that's the distance. It's now the patient now has the decision. Am I going to intervene or am I going to leave it alone? And then I can tell them, well, every single time you weigh, we can monitor this every 6 months, but you will see that percentage grow. So what Pearl allows me to do is put the onus on the patient on whether or not they want me to intervene. It's no longer me trying to explain to them, well, you have this mystery decay that I can't really tell you where it is or show you where it is. They can see it because Pearl marks it in fuchsia pink. And I love that as it gets deeper, the color gets deeper. So if you go, could you go back for me, please?
Of course.
If you see the lower right 4, that's fully enamel decay. And I can say to the patients, a lot of people ask the question, well, doesn't it make you hyperreactive and you just want to go fill everything? I say to the patient, you have that decay on the lower right 4 because you're not flossing. You know, you're not able to clean that space adequately. I will then equip my patient on how to clean that space. We'll use the TP brushes, we'll use a fluoride toothpaste, we're going to use floss. I'll check it out again in 6 months' time or in a year's time. If that's not remineralized, then we can go and intervene. But the patient is aware that it's the lack of adequate oral hygiene within that space that's caused this. So it's fully on the onus of the patient. I always say to patients, what I do in the dental practice is 5% of the job. What you do on your day-to-day is another 95%. And Pearl shows that. It picks up on things. I never, before using Pearl, discussed hypomineralized enamel to my patients. Now, no one walks out without me telling them every single spot that they're not flossing. And they're better for it. They come back for their checkup appointments and they ask me, Amanda, how is it doing? Can I see the x-rays? What does the AI software say? You know, because they're interested, they understand. Pearl has the most amazing tool. And for me, it's where it says print out, because I just print it out and I give it to them and they're counting their teeth as well. So you can print out all the reports, and I have my patients counting their teeth. So they know between tooth number 7 and 8, I have a hypomineralized spot there. I just need to floss that area. Between tooth number 7, and because Pearl also can detect tartar between their teeth as well, they're aware that that spot is prone to tartar. okay, or calculus. I need to clean that more adequately. That's a spot I'm frequently missing. Our dental hygienist loves the tool because she can show them the tartar, she can show them the bone loss as well. And she says to them, if you don't clean this, that 3 millimeter between your lower right 5 and 6 is going to become deeper. And because of that, you're going to keep on having gum problems, you know? So she uses it in a way that I would never have even used it. So she can now explain periodontal disease that even a layperson can understand to a greater depth. It's a tool that I feel like everybody should be using. My practice is so much more elevated. Even the ability to show the periapical pathology as well, because Pearl can highlight that. Pearl picks it up. It's very difficult. I had a patient in a few weeks ago. She was a 19-year-old patient, hadn't been to the dentist in 13 odd years, came in with 13 sites of decay. No knowledge about dentistry and the importance of dentistry and significant. How would you begin to explain that to a patient in a mixed practice? I'm privileged that I even have 30-minute checkups. A lot of dentists don't have that. But even with that, with someone that doesn't understand the language or the importance of oral hygiene, how do you begin to explain 13 sites of decay? Pearl, that printout was extremely crucial in that appointment because in a very little amount of time, I was able to pass across the necessary information. And she was able to take that home and explain it to her family so that she could then proceed with treatment. That's what Pearl does in day-to-day for me.
Yeah. And as they say, picture speaks 1,000 words. And it's true. It's true here because the patient engages better. The engagement of the patient is much better. They're motivated and they understand where to focus more.
Yeah.
Am I understanding this correctly, Amanda? So you use this with every patient?
Every single patient.
Okay. What about you, Kunal? Do you use second opinion with every patient?
I use it with every patient, and like Amanda does, after a checkup, I will go through their X-ray with every single patient, and I will make them sit next to me, and I will go through each individual tooth, and I will show them the depth of the pink shade. Like the deeper it goes, it means it's penetrated further. So which means it needs some kind of. If you're proactive, you want to save it. If you're reactive, then obviously we can let it progress further. But the higher chance of it needs more invasive work. So the ball's in your court. What would you like us to do? But before we do anything, it's best to understand why this is happening.
Thank you both. So now, Harpinder, tell us, how are you using it in practice?
I think I'd like to just share how I actually stumbled upon Pearl AI in first instance. My dental chair, someone else broke it. No one told me who did it. The chair broke, and the circuit board on the chair had one of the fuses had basically fried. So the chair was able to go back and forth, but it wasn't able to go up and down. So it happened on a Tuesday. I've got patients throughout the whole week, and in my mind, I'm thinking, how am I going to get this fixed? Because the engineer can't come out till Friday. Anyway, so I manage back and forth, back and forth with the chair. And I'm taking X-rays, and I'm looking at the X-rays, and I'm talking to it with the patient. I'm thinking to myself, I'm sure there's something wrong with these X-rays. I'm sure there's some pathology somewhere. How am I going to get this chair fixed? My mind is actually focusing on trying to get this chair fixed. So that evening, came home and I just went on Google and I just went, I'm sure there is something AI related that can assist with X-ray, diagnosis, helping with diagnosis. And so I stumbled upon Pearl AI and I sent you guys like a message and went to sleep. And the next day, someone, I think Rabia, you contacted me and we arranged for a sort of a demo. And after the presentation, I thought I need to implement this into practice and see how this would work, because we are all open to human error. We are not perfect. We are not 100% all the time. And I find that with using Pearl and all the associates and the hygienists using it as well, I think from one aspect of a safety net for us to not miss anything, totally is a game changer. Because what I try to do with patients is I use it for every patient. if I'm doing a new patient and I'm taking bite wings, I will assess the X-ray myself first, and then I will tell the patient, there's another thing I'd like to show you is an AI-assisted software that helps to read X-rays. Immediately, sort of the ears perk up, eyes go, what? You got an AI software to this? You put it on the screen, and yeah, sometimes I've missed lesions, and and that is what Pearl AI is really helping me to do, is pick up on these things before they become a problem, helping with patient education, like you guys have all said, from an informed consent point of view as well. You are showing the patients exactly what's going on. Hypermineralization, I never spoke about that either. You see the lesion and go, well, yeah, it's probably going to stay there for a little while, might progress, we'll see what happens. But now you've got these images, you've got it in illustration method. So here's a copy of it. Take it away. Decide what you'd like to do. I know, peace of mind, I've recorded everything and I've got an assistants to do that. So for me, it's total game changer. And I'd really, really encourage dentists to use this.
And so it
from a
truly is what it
litigation
says it
perspective,
is.
it also helps.
100%, 100%.
I agree as well, because people underestimate how solitary dentistry is as a career. You're sat in your surgery alone. You have to diagnose and treat. And it's a very high stress situation because patients come with all sorts of baggage as well. And you have to decide for all of these things on a daily basis. It's just, it's relaxing to have something, something there that just tells you, I'm not,
because you're not always going to be in a
something.
very happy mood. You're going to have, like us, we have young families, we got kids, we know what kids are like. You come into work tired, sometimes you may just miss things. Whereas with the AI there, it can help you to identify things that you may just say, okay, yeah, I can't see anything. You quickly just have a look on the X-ray. But with the AI there to help you, you won't miss small caries or things that you can just have a discussion with the patient.
That's it. Within this profession as well, you have to be at 100%, 100% of the time. There is no off day. There is not a second for you to switch off. So this in itself massively helps. I'm surprised people that don't use it. I have had, I don't know if Rabia, if you've got a slide that can also show sort of the widening of the periodontal ligaments as well.
Not something that I can. So what we could do is show that in a demo. So if anybody is interested in seeing Pearl in full action, then I would highly recommend that we book in a demo for you. So on that note, we'll move on to the second question, if that's okay with everyone. And yes. I'll start with Amanda this time. So how is the use of second opinion beneficial to your patients, and what have your patients' reactions been like towards the software?
Oh, I love seeing the older generation witness Pearl for the first time. It's almost, they're like, dentistry is, because they can compare. They have that years of comparison. They're like, dentistry has completely changed. And I find that they're a lot more trusting. It's funny because you have all these years of study and you say something and they don't believe it, but then they see it on Pearl and it's 100%. So I find that there's so much more uptake. And I've had the privilege of being able to talk to some university students as well and demo what Pearl can do for them. And they're absolutely amazing. And they'll all tell you, they all say radiographs are probably their weakest point. So for them, having this tool available to them to be able to interact with the patient and even understand dentistry as well, and I guess the progression of decay and all of that is, and to communicate with your patients is amazing. I also find that I'm having a lot more uptake in treatment. A lot of people that were on the fence because they couldn't really understand what was going on, I find that they're a lot more willing to be like, do you know what? I've seen that 6 months ago, it was there, and now it's there and it's even deeper. Can you intervene before it becomes a root canal? Because nobody wants the dreaded root canal. I think being able to like separate the two parts is probably one of the best things Pearl has probably done for them. So I'm finding a lot more uptake in treatment as well. A lot of my patients are going from are becoming a lot more reactive, and they just want to nip it in the bud before it gets any worse.
That sounds really good. And you, Harpinder? What are your patients saying?
I mean, very similar to Amanda's kind of approach to it as well, where the feedback, sorry, that she's given, it is where you're showing the patients via Pearl, because you could explain it in the past without using, when we weren't using the AI software, and you're trying to educate or give an X-ray crash course to the patients, but the moment you start showing them illustrations and the colors, I mean, it's totally sort of a game changer for us. The ease and understanding, the ease that they have in making informed decisions, the ease that they can actually see what the percentages are showing and what the progression is like, and you can explain the journey of how caries will progress and what it would lead to if we don't treat it. In terms from an education point of view, it's brilliant, and patients are very receptive. And like Amanda said, it's for the older generation, it's, oh my gosh, I can't believe it's progressed, dentistry progressed this much. So it's great.
It's really good. And Kunal?
I agree with both of them, because what I find is the older generation, when they come in, they come in, oh, we just had dentists at schools where they just used to drill, fill, next one, drill, fill, next one. They were never understood why, and most of them say we just had a filling because they wanted to do a filling. But now seeing technology there, they're quite impressed. Like, this is how far dentistry has come, and when they see in colors, they have a better understanding. With the older generation, with the younger one, because they're so used to most of the life they spend on social media, internet. So seeing these tools helps them to understand what state their teeth are, and it helps with the uptake, because now, like Amanda said, patients hate the word root canal. So they're being reactive about it, they're being proactive about it, they're having those treatments before it becomes quite invasive. So I'll definitely say it has helped with the uptake of treatment and the engagement that we gain with patients.
Okay, that's really good to hear. And have you had any patients, now it has been a year since most of you have been using it, so you've had patients that came in a year ago, have since returned. Have they been interested to compare the x-rays that they had
Absolutely.
previously?
So I get patients asking me the other day, just last week actually, they go, oh, it was a perio patient, can you show me how much bone has changed over time? So they could see the measurements, because the last time they even remembered that it was about 3 millimeter. So where is it compared to that? So they're talking numbers rather than just a black and white image, which, if we were not dentists, even if as a dentist, we sometimes don't understand what is this? It's just a black and white image. But now with measurements there, it's physical numbers. They love numbers. And they can see, oh yeah, last year it was 3 millimeter. Now it's 4 millimeters. So there's been a change, or it's 3.2. So it's a small change. So they have a better understanding of what is happening with their own teeth.
Mm-hmm.
We don't have to sell anything. They are understanding, and it just makes their treatment or giving options much easier.
That to me indicates a behavioral change. They're now more welcoming.
Absolutely.
And involved in their own treatment planning.
Yes, we're no longer seen as a butcher, because that's how they used to term the old dentist.
Yeah, that's brilliant. Oh, thank you for sharing that. I will move on to the next question. This one is a little bit of a long one, so I'll possibly break it up for you guys. So first of all, has using second opinion benefited your business growth? So Harbinder, if I could start with you this time.
Yeah, in short, definitely. A few reasons why. So you have one, the identification method. So, for example, just touching on sort of the caries. As humans, we're prone to we're not perfect, and lesions that get missed, Pearl AI is helping to identify them. You're then able to establish a sort of a treatment plan enough force in that you're not missing anything because the patient experience is being well received, and patient.
We just lost him for a moment there. He will be back.
Braces would go ahead with it. Whereas now, where patients come with 50-50 mindset, do I need to do it? Having the iTero there helps them to understand, like, okay, this is my before, this is my after. That instant reaction within 30 seconds or a minute, that helps to sell, because we are being a salesperson. I'm being a salesman without being a salesperson. If you know what I mean.
I mean, there's an ethical component to it as well, but because you're not because a lot of patients I've seen as well, that the perception that they had of dentists in the past was they're just trying to make a quick buck, they're trying to make money from me.
Yeah.
But exactly, but when you say to them, look, the evidence is here. I'm showing you this requires treatment, or it's always up to you if you want to leave it alone. But this is what could possibly happen, and it's just that you're leaving it in their court, and I found much more uptake, and so have the associates.
Yeah, and going back as an associate, I once had a case where I had an NHS patient on benefit who basically came for a checkup after 2-3 years, and she wanted a treatment plan. So I gave her X, Y, and Z teeth needs filling, and I said, okay, and she goes, I don't want anything to do with NHS. I want private treatment. So I gave her, can you give me costing for white filling? So I gave her the costing, and then there's nothing there. A treatment was not
glamorous at all.
I'm sure there is obviously people are being principled because of a reason. You want to be your own boss. Okay, I'm sure there's benefit, but the benefit, Harpinder he might have experienced it now because he's been as a principal for so many years. You reap the benefit after such a long time. Because at the moment, because I'm new, I've got a lot of loans to pay. So for me, from a monetary value, I'm not seeing the advantage yet.
Cash flow.
Yes, cash flow is always a big problem. Yes.
Yeah, it's a big thing. It's a big thing. It took me ages to understand it. Sorry.
Robbie,
I know we're not talking about AI.
Robbie, what's going on?
So now the second part to that question is, could you please share any data or personal observations on how Pearl AI has impacted the efficiency of your patient's workflow, and whether it has significantly altered the way your team collaborates on patient care?
Are you frozen again?
No, that's to you, Harpinder.
Oh, sorry, to me.
Yes.
Sorry. So for me, in terms of how we are collaborating with each other, so there are, of course, you'd be referring cases to other colleagues. For example, if I was to refer to the hygienist, I think in terms of a hygienist prescription, it's even more detailed than it has ever been. For me, that I've noticed that as a massive difference. And then, of course, the hygienist is able to then bring up the software with the patient and say, of course, I've been advised all these sites. We can clearly see there's sort of tartar deposits, under the gum here. These are the areas that we're going to focus on. It's so much more engaging for the patient. They understand why it's not just going to go in for pain. They actually, registered what's being done, why it's being done, and for the benefit of themselves. So from that collaboration point of view, massive difference.
Thank you for sharing that.
Like they appreciate that as well. It's not just can you clean this for me? It's
I think hygienists are much better at communicating too.
Sorry?
I think hygienists stroke therapists, they are much better at communicating. Their communication skills are much miles better than us dentists.
And that's it's such an invaluable, players to the team.
And it makes their life easier at the same time, because now that therapists, there's more intakes of therapists, just because before they were just hygienists, now they're doing therapy. So they haven't had that exposure to cavities, or they're not so confident doing fillings. But having the tool there, they know exactly where to drill, they know how much, and they can work more efficiently.
I think another
I mean,
member of the team,
sorry.
I was saying, I think another member of the team worth highlighting is actually the treatment coordinator. The treatment coordinator just being able to show the patients, because obviously I give her and the patient massive treatment plan, and I give them enough time in the surgery to ask all the questions, and they forget or they don't ask it, and they get into the treatment coordinator's room and they suddenly remember 50,000 questions that she can't answer, or they're asking, which tooth is it? Well, she just brings up Pearl and she can show them which tooth is the lower right six, because she is dentally trained, at least to some degree. So all she has to do is just point, this is the tooth Amanda was talking about. So I think that that's also an invaluable tool, even in the hands of the treatment coordinator.
Yeah, completely agree. Yes.
Yeah.
They seem to have a different relation with the treatment coordinator. They just think because they're not dentists, they can speak freely, they can ask anything and everything.
It's not in a clinical, it's a less clinical environment.
Yes.
Yeah.
I love that you've added that in there, the treatment coordinator being part of that workflow. It's really important that we learn to pass the baton on to other team members. So thank you for saying that, Amanda.
I just wanted to make a point about is some important feedback that I had from my hygienist a little while ago, and she said when she worked at other practices, she never felt as involved as a team. But because we've been using in every surgery, everyone's got access to the software, and because the prescriptions are so detailed now, it's a team effort. Patients pick up on that. Patients pick up on that as well.
Yes, and so do you also have your nurses involved in that workflow?
100%. My nurse, so some of our nurses at the practice we work in are radiographically trained. So they will take the x-rays, and before I even come into the room, sometimes they've popped it up, the screen is showing with Pearl, so they can see the patient's already looking at it. Obviously, they're not trained to have that conversation with the patient, but the patient's already staring at the screen and wondering, what's that? They're already engaged even before I walk into the surgery.
And the nurses feel more confident. From my side, my nurse feels more confident because she can just she didn't have to look at the x-ray, she just opens second opinion. And she goes to the patient before I walk in that this is where we're going to be working on. And she knows exactly. Sometimes, obviously, as we mentioned at the early part of this webinar, that we as dentists make human error. So sometimes a DO will be marked as an MO, but we always go back to second opinion before drilling. My nurse will correct it if I've marked it wrong, or anything like that.
It's so important to have that nurse. Efficient. Yes, so important to have our nurses involved in the journey and to use their skill sets.
It's a teamwork.
Yes, definitely. Yeah, so guys, thank you so much for joining me today on this webinar. I want to thank Pearl for sponsoring us. I have had a few questions from the audience, if you wouldn't mind answering those for them, please. So the questions that have come up is, how quickly can you incorporate second opinion or Pearl into practice?
Straight away.
It takes 5 minutes to learn.
Straight away.
So once it's installed, it's pretty much available to you to use straight away.
Yes.
And I think it's important to
add.
I think it's important to add that it is cloud-based. So I know this was asked previously, but another thing that I do is I actually take the x-rays home. I do a lot of I work 4 days in clinic. So I do a lot of my treatment planning at home. So I have their OPG, their radiographs, all of that when I'm doing my orthodontic treatment planning. A lot of my ortho treatment planning happens out of the office. So because it's cloud-based, I have access to all of that. I use it as part of my day-to-day treatment planning tools. So if, for example, you don't want your patient to turn around and look at the screen, you can have it on your iPad and show it to the patient on your iPad, because it is cloud-based. You just need the website, your username and password, and it's available to you everywhere.
Yes, ever evolving. Like initially when I got it, I could only use it on my computer at work, but over time on my iPad, now I even can view it on my iPhone, which makes it easier.
And that is a new feature that's been made available to you guys. So I'm glad you've mentioned it. It's now available to you on iPad and phone. So that's really good to hear. Do you think it will replace the dentist?
Absolutely
Well,
not.
unless the AI grows arms and learns how to drill and fill. No.
Well, you might be able to work from home.
Technology is there to be embraced.
You can work from home.
Yes. It's there to be embraced. We shouldn't be scared or threatened that it's going to replace us, because all it's doing is it's making us more efficient. It's making our workflow easier, and it's giving us more time to speak to patients, build our rapport with them. Whereas in the background, we can do our notes. So I know we talked about Pearl earlier, but we can do our notes through different applications of AI. Pearl, we can make that diagnosis, because let's be honest, stress level these days, everyone has a very high stress level. There's a lot of things going on in the background. You can miss things, but just to give you that peace of mind, having an AI to support you can help you to just identify the little small things that you may miss on a day-to-day basis.
Especially a Friday afternoon, right?
And if I could add to just what Kunal's saying, it's quite recently in the news, there was an article about AI assisting for cancer diagnosis as well. And of course, we're just talking about teeth, but obviously the cancer, so life-changing things. It's coming back to the patient experience as well. So you are able to pick up on things before they become an issue. And it's not going to replace us. It's just going to make us more efficient and more effective at what we're doing, and more effective at having a conversation and discussion with our patients, making sure that they're so much better informed than they have been before, but with the assistance of the software. And I think there needs to be naturally an embracement to the changes that are coming with AI. Don't fear it, sort of acknowledge that it's going to be there, and try and incorporate as much as you can into your, like it is, of course, life is stressful. I mean, work is stressful. What can make life a bit easier for you? And yeah, AI is helping.
Well, AI is helping. Older generation, they don't want to use phones, but everyone uses an iPhone or some kind of smartphone these days. So we don't have to be scared to use something. And like you mentioned, that cancer, I believe it's to do with on the BBC, they was talking about the breast cancer, where
that's right.
The lab analysis showed the X number of patients only had 44, but the AI picked up 88. And what that did is it shortened the treatment, where patients used to have radiotherapy for months and months. It shortened because it was picked up at such an early stage.
How many lives can this save?
5 days.
How many lives can this potentially save?
Yes.
You know, thanks to AI and the speed of it as well, speed of diagnosis. Incredible where it's going to go. I only hope there's only one suggestion I've made in the past, Rabia, and you're gonna hate me for this, but I would love it if Pearl AI was able to implement something that gave us a kind of a template, whereby after an X-ray is taken, for example, it can assist with the grading, it can assist with sort of identifying things that are there, and as a clinician, reporting, and you then,
because we are lazy people.
I don't want to put it like that. But you know how Kuroku, like you mentioned, I've also used that as well. So an element of that with Pearl AI.
I'd like to see some kind of collaboration. I'm not saying Kuroku.
You have to sign it off. You need to sign it off. Of course, you need to sign it off. And one more thing is, if you were taking sort of bite wings 2-3 years later, if there was a way to naturally compare
I know for a fact that that's coming, that's an upgrade that they're working on.
I'm happy with that. I'm happy with that.
Yes. It will help us as a dentist and also help the patients.
Absolutely.
As a company, Pearl are very on board with taking feedback from you guys. So if you have already reported this to them, then it will eventually come into play. I hope.
Spoiler.
Yes.
Amazing.
It takes time. But
yes, absolutely.
Please put your suggestions forward.
But yeah, so as we can see, there's collaboration with kind of note-taking application would be beneficial, because at the moment, I'm not sure if I should be saying that most modern notes are done by my nurses, because now they can just click buttons. So having this integrated with Kuroku, or I don't know, whatever CareStream or whatever apps other people use, having integrated so they can pull through the data, like Harpinder said, would be brilliant. So we can spend more time with patients talking rather than spending time behind the scenes typing notes.
That's a very good point. We will take that on board. And just the last question that we have here is, how accurate is it? So if you've been listening to me during your trainings, you will know.
So yeah, so I'll just jump in here. So obviously we know artificial intelligence is something that is based on data that is provided. So the more data it gets, the better it becomes. So I would say over 12 months, it has progressed. It has progressed in a better way. The success rate is more now. Before, I believe it was in the 80s. Now, over 12 months that I've been we're using Pearl, I've seen personally, I've seen the accuracy is much better in terms of identifying things, even with OPTs, with PAs. And I believe it's somewhere in the region of 90 to 95%.
We're at 93%.
Yeah.
And
I would
even
say, sorry, so I was going to just interject and add to that, actually. I would say it surprises me how accurate it is and its ability to learn as well. So the more feedback you give it, the better it becomes. And how quickly they upgrade and implement that, it's a little bit creepy. But I find like even its ability to, because as humans, we will struggle with, I don't care how good your x-ray taking skills are, you will take an x-ray that overlaps, the contacts will overlap. And you know that that's extremely challenging to read. Pearl doesn't have that problem. I find that Pearl can read even when the contacts are overlapping. It's shocking how effective it is and how efficient it is at reading, because we just see, well, I think the studies show that we can identify what 10 shades of gray. Pearl can identify into the hundreds.
Yes.
Well, that's what, yeah, that's it.
So it's amazing. So efficiency wise, I would say, I know you said generally you're looking about 93. I would say I'm probably about 98%.
100%.
And the error, yeah, I think that's because the error, and I'll tell you the error that I've seen. So it's not decay. The error that I've seen is when a patient comes in and they have a lot of periodontal ligament widening due to perio disease and possibly some occlusal effects, it struggles to find out where the bone ends because it just takes it all the way down to the apex, which is I think it's a valid error what I've reported, but that's like the most recent error that I've seen. Because when there's that a lot of space between the tooth and the bone, literally the tooth's almost floating within the alveolar socket, it's struggling to find out, is that the bone level or does it just go all the way to the apex? And which I reported, and I'm sure I'll go back in about a month and it will all be gone and fixed. So decay identification, I don't see problems anymore, Pearl. Earlier on, maybe more so.
It's important also to recognize that even if it was 100% accurate, we're still the experts. We've still got to be able to recognize the false negatives and positives that the system may be showing and edit them off prior to sharing them with patients or adding them to treatment plans. So thank you for sharing, guys. Kunal, I think you were just about to say one more thing.
No, I was just saying that as you mentioned, that it's still a computer, but it will never take away that human intervention. Like you're always going to view it. You're always going to take a look at the AI, but end of the day, it's what you perceive as to be correct. Like it's ever evolving. There's always going to be changes. Like we are progressing towards the OPT. Like I raised it with you a day where I was looking at a wisdom tooth, and it didn't picture the end of the apex of the wisdom tooth on the nerve, but over time that has been corrected. So as more data, the good thing with Pearl is the team behind it are there to look at things, and they are always happy for feedback and making changes. But you don't find with a lot of companies these days. They just develop a software, let it out.
Yeah, I mean, what Amanda and Kunal have said. I mean, we have to remember that this is just a diagnostic tool. You know, ultimately, you're responsible to check what highlights are clinically what they're saying. You know, so what they're looking like, what they present as. But But I still feel, 100% sure that I believe everyone should be using Pearl AI, nothing else. But they should be introducing this into their practice on a daily basis. What a reassuring tool to have.
Yeah.
And as an
don't take it blindly, but use it as a interactive tool to discuss things, to engage the patient so they can make a more of an informed consent rather than just take your words blindly.
And an associate as well. So I know both of your principals, but coming from an associate point of view, I don't think I would work in a practice that didn't have Pearl, because for me, it shows that I'm in an environment that is technologically advanced. That they're on board with the direction that the world of dentistry is going. Well, and it just gives you that added security. That what I'm seeing is what all my colleagues are seeing. So I think it's something that's so important to implement. And I always say that for the cost of it, it's one filling. It's one filling.
If you're private.
Yeah. Well, yeah. So it just shows it's one patient, let's say, even if it was under the UDA system, it's one patient. And it just shows you that you're in a team that cares about that patient journey.
Yes. I can just interject there. Like, what people think is to install or employ the Pearl application to your practice. You don't just have to be a practice owner. Even an associate can do it. It's much more easy. All you have to do is get the sign-off from your practice owner that you're going to install this. There is no data breach. There's nothing like that. So it's easy to install that even as an associate. The whole practice can gain benefit from it.
But a principal would have to agree to it, though, because it is installed onto the folder where all the X-rays are stored. And so at some point, people may want access to it.
So you don't just have to be a principal. You can also be an associate as long as you've got the approval from the principal.
Yeah. Guys, I want to thank you all for joining me. It's been a pleasure speaking to you all and finding out a little bit more about how you're using second opinion in your practices. I want to thank Pearl for sponsoring this for us, and to FMC. Yes, enjoy using second opinion, and I look forward to seeing you all at some point soon. Thank you.
Thank you, guys.
Thank you.
Thank you.
See you later.